Preparing the stream. Okay, I think we are live. I just wanted to thank everyone for being here. This is first of hopefully many of our health chats. It's basically our attempt to help answer your questions about health coverage and enrolling through the Affordable Care Act or Medicaid. I'm William Lineberry, and I'm the Communications and Marketing Manager for Enroll Virginia, which is a project of the Virginia Poverty Law Center. And answering questions today is Amber Perrone, and she is Enroll Virginia's Outreach Coordinator. And she'll be answering questions in English and then offering a Spanish translation as well. So just a few housekeeping notes. We'll start with some questions that we've already received through direct messages from other people, and then I will be monitoring the comments for other questions that come in. I'm not sure we'll be able to answer all of them, but if we're unable to get to your question, we'll save it for next time. And you can always reach out through a DM if it's urgent or of a timely essence. So we'll try to keep the Q&A to roughly about 10 minutes. And with that, I'll go ahead and ask Amber the first question. So the first question that came in, Amber, is, I recently lost my job and need health insurance. What options exist for me?
Sure. So good morning, everyone. Thank you for joining us, and it's a pleasure to be here. If you have recently lost your health insurance that was through your employer, there's a few options. One of them would be COBRA coverage, if that is an option through your employer. And there's also some extra help that's available with that now. And it's possible that you can receive COBRA premium free from now through September. So please contact us and also your employer to get some more information about that. If you're not eligible for COBRA, you can certainly be possibly eligible for the Marketplace, which offers health insurance through several different private health insurance companies. And you can also possibly be eligible for Medicaid, just depending on your situation. So please contact us and we'll definitely advise you for free and help you with the application process. Entonces, hoy, la pregunta era si ustedes pierden su cobertura de un seguro médico por medio de su empleador, ¿cuáles son sus opciones? Y las opciones que tienen es que pueden obtener un seguro médico por medio de COBRA, posiblemente si son elegibles. Y ahora hay una ayuda extra financiera que pueden obtener donde la cobertura de COBRA sería pagado por completo desde ahora hasta septiembre de este año. Entonces pueden contactar a su empleador para más detalles o a nosotros también. Si no son elegibles para COBRA, es posible que serían elegibles para un seguro médico por medio del mercado federal de seguros médicos con una ayuda financiera o posiblemente por Medicaid, dependiendo de su situación. Favor de contactarnos y nosotros podemos darles consejos gratuitamente ahí apropiados para su situación.
Great. Thank you, Amber. And our next question is related to the Marketplace. They said, I've tried to get health insurance to the Marketplace before, but it's always too expensive. Has anything changed recently to make coverage more affordable?
That's a great question. So there have been a lot of changes over the past few months under the Biden administration that has made coverage more affordable. If you have never applied to the Marketplace, we definitely encourage you. It's open enrollment now through August 15th of this year to go in and to look at your options again with one of our navigators. If you currently have a policy, it's also advisable to go back in and to look and see what your tax credits would be, because they did raise the amount of tax credits that you can get to help pay for your monthly premium or the monthly cost of your health insurance. So yeah, now is a great time to go back in and look at your options. La pregunta es, antes yo apliqué para un seguro médico por medio del Mercado Federal de Seguros Médicos y todos los seguros médicos eran demasiado caros. ¿Hay algo que ha cambiado para bajar los precios? Y la respuesta es sí. Debajo de la administración de Biden han habido muchísimos cambios en los últimos meses, y uno de ellos es que la ayuda financiera ha aumentado para estos seguros médicos. Entonces, realmente animamos a todos, si es la primera vez que quieren obtener un seguro médico por Obamacare o el Mercado Federal de Seguros, por favor, contáctanos y podemos revisar sus opciones sin ningún compromiso. Y también, si ahora tienen un seguro médico, necesitan regresar y volver a actualizar su aplicación para recibir una ayuda financiera mayor.
Great, thank you again, Amber.
Sure.
The next question that we have is related to the American Rescue Plan, President Biden's American Rescue Plan, that recently a lot of changes went into effect on April 1 related to health coverage. And they are just asking what the American Rescue Plan has to do with health coverage.
Another great question, and the answer is quite a lot. And the great news is that it's of lots of benefits for the American public. So one of the changes is, of course, what we just discussed, that now the tax credits have gone up quite significantly to help people with their monthly premiums or the monthly cost of health insurance. So everyone should go back in and update their application to make sure that they're getting the most amount back. Also, there are changes to COBRA that was made. If you are eligible for COBRA through health insurance or through your employer, it's possible that you can get COBRA subsidized, which means that you don't pay for it through September. There is also more help coming this summer for people who are on unemployment. So there are more details that we're going to be releasing about that. And also a really big change is that the open enrollment period was extended as well through August 15th. So people have more time to go back in and to look at their options. And we can provide help with that. We offer help for free from the start to the finish. And then, of course, along with that, there's also some changes that have been made to Medicaid. So we just really encourage people to seek us out for some help. La pregunta fue, ¿cuáles son los cambios que fueron hechos bajo el plan de rescate americano y qué tienen que ver con el seguro médico? La respuesta es que son muchos cambios y la buena noticia es que son cambios buenos para la comunidad americana. Y estos cambios son primeramente que el periodo de inscripción abierto ahora es hasta el 15 de agosto, entonces tienen mucho tiempo para entrar, para revisar sus opciones. También otro cambio es de que ellos aumentaron la ayuda financiera para obtener estos planes de seguros médicos, entonces pueden obtener un seguro médico a un costo menor cada mes. También aumentaron la ayuda para las personas que han perdido el empleo para obtener una cobertura por medio de COBRA sin tener que pagar. Y también para las personas que estaban recibiendo los beneficios del desempleo, este verano también van a dar más ayuda para esas personas. Entonces, hay un montón de cambios que están ahí. Y otro cambio también es que ahora no hay límite de ingreso. Las personas pueden ganar la cantidad que estén ganando y pueden recibir una ayuda financiera basado a eso. Entonces, eso es otro cambio muy importante para las personas que tienen sus propios negocios o que ganaban demasiado para calificar para ayuda financiera antes. And just one change that I added on there that I remembered is also very important for our self-employed community, that there's no longer a cap on the income limit that you can have. So you can actually qualify for health insurance with tax credits, without an income limit now. So come back and see us, because that's a major change for our self-employed community.
Yeah, that's a really, really good note because, that income level has just seen a lot of positive change from that and have a lot more options available. They're a lot more affordable now, from what I understand.
Yes.
So making our way to the last question, is kind of to the bread and butter of like what we do. But this person asked like that they are trying to enroll is really complicated and can be kind of a barrier to even getting coverage, and they would like to know what help, if any, is available.
Sure. Well, we can definitely help you with the application process. Like I said, from start to finish, we cover the marketplace, we can cover Medicaid, a variety of different subjects when it comes to health insurance. And so you can definitely reach out to us. You can reach us by phone. You can call us at 1-888-392-5132. And then you'll just put in your zip code and it will connect you to your local navigator. And you can get an appointment with us if you just want some information over the phone. There's no commitment to, enrolling from that first phone call. The decision is totally the consumer's. All of the help that we provide is free to the community, and we can offer help in several different languages. And we're just really here to help navigate and to provide information and let the consumer take that final decision for what's best for themselves and their family. La pregunta fue, oh, and I'm sorry, you can also make an appointment online. And I know Billy's going to share that link for everyone as well. So you can contact us by phone or online. And you can also, of course, reach the marketplace with their call center or apply online at healthcare.gov. But if you're overwhelmed, because health insurance can be a little bit of a confusing topic, just reach out and we're definitely here to help you. We've got navigators statewide that are ready to help them with that process. La pregunta fue, el aplicar para un seguro médico a veces es un poco confuso y a veces siento que no entiendo lo que estoy haciendo. ¿Cómo me podrían ayudar? Y la respuesta es que tenemos un equipo de navegadores a través de todo el estado de Virginia que son bilingües en español e inglés, y también si necesitan servicios en otros idiomas tenemos un navegador que habla coreano, también otros diferentes idiomas, y podemos conseguir traductores para ayudarles en su propio idioma. Entonces pueden contactarnos por medio del teléfono, pueden llamarnos al 1-888-392-5132 para hacer una cita o para pedir más información. Y cuando llaman, nada más tienen que ingresar su código postal y eso los va a conectar al navegador que está más cercano a usted. También pueden hacer una cita por medio del internet y Billy va a compartir el enlace para poder hacer eso. Y toda la ayuda que nosotros proveemos es gratuito a la comunidad. Entonces, no hay ningún tipo de compromiso que tienen que comprar cierto tipo de seguro. Todo es gratuito. Nosotros proveemos la información y ustedes son los que toman la mejor decisión para la familia de ustedes.
Great. Thank you so much, Amber.
Sure.
I think that is all. We're about at the 12-minute mark, so that is all we're going to be able to get to today. But like I said, if you have any questions ever, just feel free to direct message us or private message us, and we'll either answer it on the spot or we'll answer it in the next health chat that we do. I just want to thank everybody again. If you have any questions or want to find out more about us or find a local navigator, just go to enrollvirginia.org. I'll link it in the comments as well. And you should be able to find a local navigator or answer any other questions that you have. So thank you again. I hope you have a great afternoon.
Thank you all. Please reach out to us.